now we're going to repeat the process with our dry Q-tips. Again, going all the way in to our south, to the side, this side, a little tight again, you can move it if you need. And then we're going to tilt down and dry, come on. Okay, so now we're going to change the collar. If you need to apply nystatin powder, you want to do it away from the patient, okay, because it'll be an irritant effect. You're going to go ahead and shake off all the excess, okay? And again, that's something the physician has to order. Not every patient has that. I'm going to have this here, and if you have a partner, you're going to have them hold your trach as you loosen your one side. Okay, and you don't have to push on the trach, you just want to hold it securely, okay? I'm going to take a wet 2x2 and I'm going to clean the neck, again making sure that my skin is nice and pink and healed, that there's no sores or anything. And then I'll take my dry one and we'll repeat that. Okay. Next I'm going to attach my collar, my new collar. I'm going to thread it through the eyelet there. Okay. I'm going to hold, and when I lift my patient, I'm going to pull the old collar out and bring the new collar around, okay? And I'm going to repeat that process here on the other side. Remove this collar, take my wet gauze, again cleaning my neck, making sure all the way around, wiping away, making sure it's nice and healed. In. Okay. Then I'm going to pull my other half of my collar around. This time when I thread it through, I'm going to make sure that I'm mindful not to pull by the Velcro because it will pinch their neck. So you want to pull the collar actually by the collar and secure it in place. Okay. Before we let go, we're going to make sure that I can only put that one finger in the back here. And you want to check it in the back, not in the front, because if it's too loose, you may accidentally decannulate the patient. When that's in place, now I'm going to put my dry dressing. When you insert your dry dressing, your Optifoam, your Medplex AG, whatever you're using, you only want to use your pinky. Okay? You never want to use anything like tweezers or the end of your Q-tip because you may nick their stoma and cause some damage. So it's important that you don't ever use that. Okay. Sometimes if it's a little snug, if your partner's holding, you can also relift and put it. But the best way to do it, the most secure way to do it is when it's fully attached, because that way you prevent it from decannulating. And it's safer that way. So once I have it in place, I'm going to kind of shimmy it a little bit and put it in. If your patient has a ventilator and they're connected with your, let's use that as an example. If you're connected, you're going to place your tie string around. This is going to go crisscross underneath, and then you're going to tie a nice little bow on top. You never want to circle it around, double tie it, knot it, because in the event of an emergency, you need to be able to get this off immediately.